Hey there, Mark and Brian here, somewhere in this realm of Fitness4Life PT. Today we're going to bring you some information about knee replacements.
Use your big words. Okay. Got it. So we're talking about total knees because I've had a request for a year and she finally wore me down, she who will remain nameless, but talking about total knees. So there's a lot of total knees done every year. Now, here's some advice we want to give you if you know that you're going to be getting a total knee. The best thing you can do before having a total knee replacement is to prehab that. So to train before you have your surgery, because what is known is that if you train those muscles, that joint, before you have your surgery, you come through a lot better. So things that you need to think about and work on. Number one is that whatever range of motion you typically have before your surgery is the motion you're going to retain afterwards. So with that in mind, it becomes important that you try and increase your range of motion if you do have a deficit, so that when you do have a total knee replacement, you're going to come out with full range. That's an important one because a lot of times what me and Brian see when they come in to us after having their knee replaced is they can't fully straighten their knee, and for sure they can't bend it, but we're always more concerned with the straightening first, because if you don't get your knee straight, you're always going to walk with a limp, your gait's going to be altered, it can start affecting other muscles. So range of motion is primary. We have had patients in here that prior to surgery could not bend their knee past 60 or 70 degrees, and after surgery, because they did working out, worked on the range of motion, worked on some strengthening exercises to keep those muscles strong, they were a lot better after their surgery and they came through a lot better. So what's recommended? Do some prehab. Okay, to give you a couple ideas for range of motion. So range of motion needs how far you can straighten and bend it, just like this. So I want to give you a couple numbers. Walking, you need 70 degrees of bend. So to walk normal, that's the kind of range you need. To go downstairs, you need 100 degrees. So that's past 90, obviously. See how smart I am? So 100 degrees of range of motion is a good goal to have before you go into surgery, at least, because you need that for function. Second thing is being able to bend your knee that much when you're sitting, your knee isn't hanging out like if you're in a movie theater in the aisle. So some things to keep in mind: you need to train for a surgery. That's our opinion. There's a lot of medical professionals out there now that will actually prescribe prehab before their surgery because they know that they do better. So in our upcoming videos here, we're going to show you a few exercises to do to help with that before you go into surgery.
That's right.
Well, tell them who we are and where we're
Oh, we're Mark and Brian. You can contact us at fitness4lifept.com.